She Slayers, and welcome to another episode of She Slays a Day podcast. I am your host, Dr. Lauryn Brunswick, and this is one of our final episodes of the year. I'm pretty sure the next 2 weeks are going to be our best of. I don't know. My editor's like, oh shit, they are? Okay, I better get on it. There may be one more episode. I don't really know. We'll get around to it. Okay, so today I did something. I'm doing something new. Okay. So like in my conversations around the world, like at the Kajabi conference I went to in October in LA, I talked to a dentist. I talked to a lawyer, and I've talked to vets. And basically the pillars that this podcast stands on, which is bringing more freedom to like a brick and mortar profession, right? Like this, more freedom. And so then through that, we can cover things like leadership. We can cover, because better leadership is going to allow you to remove your time. So like all sorts of different things, right? So kind of the 3 B's that we talk about a lot is like financial aspect. So financial freedom, being bored. So like how to reinvent yourself. That one's just kind of nice because then I can talk about whatever the hell I want. I still one day do want to bring on a taxidermy specialist. Because if you don't know this about me, this is good Lauryn trivia. When I become an empty nester and I have tons of free time, I totally plan on learning taxidermy. So one time we might have that. That's that boredom piece of like some of us multi-passionate people. Oh, and then the burnout. Yeah. Bored, broke, burnout. So in my talks, like chiropractors, I don't know if you think that we are this broken profession, but we're actually really not. And that's why so many other professions have started listening to the podcast as well, because these topics, they're not nuance, like learning leadership, learning profitability, dealing with insurance, dealing with employees, team meetings, and like all of that stuff. It's not specific to us. That's like a business issue. So there is this ENT that I follow on Instagram, and he's hilarious. Well, actually, he does like really funny content, and then he'll have like a really heartfelt, serious content. And he owns his clinic. And so I invited him on. I said, like, come on, I would love to talk about insurance issues because that's, something they deal with too. And just how you are setting yourself up for ideal staff culture in a healthcare setting, dealing with mission and values in a healthcare setting, getting your employees on board, and just really physician leadership and development. And I said, as long as you don't hate chiropractors. I literally said that. I said, if you hate chiropractors, you should not come on. And he said, no, I'll come on. So it was interesting. It was interesting, keep in mind that there is, so as you're listening to this podcast, I want you to know that like some of you are like real freedom fighters in a different kind of freedom, like medical freedom and things like this. And there may be questions at certain points that you would have liked me to dig into deeper and things like that. But there's a social etiquette that is required, especially when you are inviting someone onto the podcast. So like, so some of you may just have a general issue with all surgery ever, and you just need to like chill out a little bit and things like that. But just know like this was an interesting thing for me as a host, just learning how to talk about like the alignment that we have in this profession and all of the shared values. So if you catch my drift, you will. All right. I don't have any other announcements. We're just going to like get into it. Oh, wait, I do have one more. So a lot of you have responded and sent me texts saying Kirby needs to be on the podcast more. Now, I'm not going to shame you for like just texting me instead of like sharing the episode that you obviously liked. Could share it on social media. That'd be appreciated. Anyways, Brian, but he's going to be like, he doesn't know this yet because He's too stressed out with Christmas stuff and some like financial planning stuff that we're getting papers for. And that's hilarious because like we were really aggressive in our 20s and things like that. And so he's like having to gather all of our stuff for this financial planner. And he's like, I found, he sent me a message yesterday. He's like, hey, I found out that you have $20,000 in an HSA that we kind of did and forgot about. Like back when we had like a plan that allowed for an HSA. We don't anymore because I'm past baby making stages. And so now we just have to do like a Christian share thing that you can't have an HSA. But like, ooh, that's a good guest idea. I'm going to have somebody on to talk about the tax strategy and like investment aspect, because that's like this whole backdoor HSA stuff that is super cool. So 2025, it's coming. It's coming. Anyways, Kirby was on. He's going to be on more. I didn't tell him because right now it would just stress him out. But honestly, two kind of goals that I have for 2025 is, oh gosh, if I tell you, then I have to like be accountable for it. Maybe that's a good idea. So about once a month, I do want to keep a solo, and I want to keep those on the shorter end. I've gotten a lot of good feedback that like, yes, you love these episodes where we dig in and things like that. You love the like cadence and the ramblings and all that shit. But sometimes you don't have time and you just need a dose of Lauryn. And so we are looking for about once a month. We will ideally release this like 30-minute episode that'll just be me tackling a very specific business growth topic. Then ideally once a month, Kirby will be my guest because he's so like everything I'm not. And like, I do think, in the multi-passionate chiropreneur, small plug that is coming up Q1, make sure you're on the wait list, please. That is actually a big component. So yes, we've had multiple single people, we've had divorced people go through the program. But it's one of the biggest things that we hear them say is like, whoa, I wasn't prepared for what this program did for my marriage, because you cannot talk about financial stability and planning and all of this stuff, even like removing you from practice and how that's going to affect your life without your relationship. And so because Kirby is one of the coaches, like there are like key conversations to have with your spouse that happen in like week 2 and things like this. And it has been one of the number one feedback things that we have gotten on the course is people love just the conversations and like how much clearer together. And that just comes from years and years of me going, doing chiropractic programs, going to chiropractic conferences. And like literally some of the conferences, Kirby wasn't allowed in the room because he wasn't a chiropractor. And I'm like, yeah, but he like runs the thing. Like what? Like we're talking about decisions for this 7-figure business, but like that my husband's a COO for, but he can't be in the room. So like that was something that we really brought in of like, if your husband's a chiropractor, cool. Yeah. He's going to love the content too. But like, if he's not, or if your wife is not a chiropractor, these are conversations that need to be having and like allowing the non-chiropractic spouse to feel a part of this process is very important. How did I start talking about that? I don't know. So, oh yeah, Kirby's going to be on the podcast more. You're welcome. In 2025 goals. All right, so let's take a breath. Dear God, thank you so much for the ability to have these crucial conversations within healthcare about burnout and physician leadership. This is chiropractors are not the only ones hurting. I hear from vets and dentists that it's so hard sometimes to just get these docs to come into like rural towns and pretty much anywhere other than Nashville and Colorado. And so these conversations like we have when we look to the future of healthcare, we have this huge responsibility. There is this shift happening, this shift towards values, like in America, really looking at like what our values are around health and values of collaboration, and just really the tide's turning. And I do not think that any of the healthcare professions are going to do this on their own little island. I don't know, maybe vets, maybe they don't need. No, they need chiropractors and acupuncturists and all that, and massage therapists too. Like nobody's getting out of this just pretending that like it's just me and my clinic in the micro. And so allow us just to continue to view on the macro conversation that is happening, and just keep everybody in all healthcare professions open-minded. That's all we ask. And so we should do the same. In your name we pray. Amen. Okay. Without further ado. Oh God, I didn't read his bio. Do you want to know who I'm talking to? Jeez Louise. What is this, your first rodeo, Lauren? Okay, so I have on Dr. Caleb Masterson. He's an entrepreneur with a mission to help healthcare providers understand their real value and pursue autonomy. I don't know, insert freedom there, like autonomy/freedom. As a dedicated ENT specialist and owner of the ENT Center of Northwest Alabama, his passion lies in revolutionizing the way healthcare professionals collaborate and excel in the business realm. Isn't that cool? Yeah, I think so too. We'll make sure you can find him on Instagram. You should start following him. He's hilarious. I love his little skits and things like that. So without further ado, here's my conversation with Dr. Caleb Masterson. Enjoy.
How did you build this
Oh
this
my
network?
God. Oh my God. It honestly started as a hobby. It started as so I'm a chiropractor, and like 7 years into practice, I started like other chiropractors were reaching out to me of like, how did you do this? How did you do that? And I really enjoyed I enjoy the business process. I also started to see just a lot of the voids that were in the education about like, we really were not taught spreadsheets and business metrics, or like honestly, even like hiring or anything about running a
Yeah.
business. And then that next layer started to come of realizing as a millennial, like, so specifically within the chiropractic profession, there is this honor of working until you're too old to do so. Like, is that something that's replicated in your profession?
Yeah, so there was an article in the Wall Street Journal for recently about young surgeons versus older surgeons and the ideology of work-life balance being a colloquialism in modern healthcare, and how older practitioners knew it was a calling and they didn't mind being on call all the time. They didn't mind like not having a home life. And the new generation that's kind of rejected that philosophy post-COVID are essentially like weaklings. And it's been really interesting to see the response, the young generation to the old generation about this specific article. It's really hit a lot of nerves.
Yeah. Okay. Well, actually, okay. Welcome to the podcast. We're recording because I actually really want to talk about. So this was in the Wall Street
Yeah.
Journal or
I hope like it
something.
was in the Wall Street Journal,
It was
something
in
like
some.
that. Yeah, so basically, it was written by a surgeon, and I was actually going to do a post on this specifically, but basically the gist of it, and I don't want to misquote it because I haven't done a ton of deep dive research on it, just read other people's opinions of it, and I hate when people do that. But basically, the older surgeon was like, younger surgeons like aren't willing to adopt the mantra of like, this is a game. This is not a
Live your
game.
life later.
Like,
Yeah.
yes, yeah, like
Delay
this is like
happiness.
life
Yeah.
and death.
Hmm.
This is life and death. We're saving lives here, and there's no higher calling. And the younger surgeons are like, no, we agree that this is a very high calling, but we're also moms and dads. We're also like have a like faith life. We also have, a spouse that we want to keep. We also like are involved in our communities, and we're also leaders in our hobbies or whatever. And we don't want to give ourselves up to this thing that is not going to give us dividends socially back long term. And the older versus the newer, there's just this kind of like this tension in
Hmm.
what's actually appropriate. And so, the older think the fix to all this is finances. If only physicians were paid more,
Hmm.
then this need to work so much would be less. And the younger physicians are like, we're not as interested in high reimbursements because we never really knew them since we've only been in practice now for 5 to 10 years, and we're looking for meaning in other places.
Yeah. So, I mean, it really is. I mean, and what you're saying is, and I've heard this, like, I've talked to vets, I've talked to dentists, and they're like, yep, it's the same thing. And it's just interesting that, like, yeah, this is a generational thing where you have Gen X being like, you do the thing. This is your identity. This is
Right.
your calling. And
Yeah.
honestly, I mean, what greater calling to help people? So, like, why would you need more? And then we've got, because you
Right.
look like a millennial. Are you a millennial?
Yeah.
Okay,
Hmm.
yeah. And so then we've got like Gen Z that's like, I'm looking at them going like, well, why do you know how much debt you're getting into if you're not
Yeah.
going to like, what are you do? You want to work 3 days a week? I'm confused. I'm confused. Like in
Yeah.
your 20s? Like, no, 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 no. You
Yeah.
got to. So I feel like right now, and this is probably every generation ever,
Hmm.
millennial healthcare providers, whether you are a nurse, a surgeon, a whatever, you're sitting in between generations looking, going like, okay, I look to Gen X and I go, I don't want to do that either. But then we kind of look to Gen Z
Hmm.
and we're like, okay, we're going to need you to put in a little more grit than that.
Yeah.
So what
Well, and you
was,
even wonder, like Gen X's view of, the greatest generation. I bet you they had the same mentality toward Gen X. Like we're given everything. We gave everything we had just to maintain the country in general, and you guys are complaining about work hours. So, I mean, there seems to be this kind of general thought that those that are younger than us work less hard than us, and I think it's not that they work less hard; it's just they work for different outcomes.
yep.
And if you value a specific outcome more than somebody younger than you, then obviously the outcome that they're trying to achieve is going to be interpreted as less productive.
Yeah. And so if I understand what you're saying, you're kind of saying like the previous carrot was finances, and that is what
Yeah.
drove like financial security matched that, that was the carrot. And now we're trying to figure out with this next generation, it's not that they're bad. It's just like their carrot is much
It's
different.
different.
It's
Yeah.
different. It's not all wrapped up in this identity of I am this thing.
Right.
Do you
Correct.
feel that what is like the good that's going to come from that? Because obviously, like, there's the concern about like, well, if your identity isn't wrapped up in this life-saving thing that you're doing and you're
Yeah.
diversified across thing, like we can see the
Yeah.
flaws, but like what's the good that is going to come from that?
Yeah. So that's a long-winded answer to say that people are going to really connect with meaning again.
Mm.
And so I think that anybody that has been around any type of entrepreneurship or even medicine in general, and maybe older or may have been in the game for a long time and did well financially, probably, and not just medicine, but any business, and did well financially, they discovered at one point that, having great wealth is great, but it's not everything. It doesn't provide the source of happiness or meaning that we thought it would. And so I am very excited about the entrepreneurial spirit that I see rising in the younger generations, that want to step out on their own and do their own things, because they're going to accomplish two things. Number one, they're going to be able to directly affect the outcomes in healthcare, specifically from a provider's perspective, not a business perspective. Both of which are good, but the tension is required. Like you have to have this strong independent group of practitioners that are saying, no, this is what's good for patient outcomes. And then a strong group of business minded executives that are like, well, this is good for our financial outcomes. So right now it's like almost 100% executives. And obviously our insurance companies are really, really hurting patient care right now. On the other hand, what I learned, and well, I'm sure a lot of practitioners have learned, and when you step into the arena of entrepreneurship, you get a heavy dose of meaning that you never thought you would get. And what I mean by that is connecting with employees, connecting with community leaders, connecting with like the ability to set the vision, mission, and values of your organization. Those in just engender meaning in people, without even intentionality. And so I'm a surgeon. I operate sometimes 3 days a week. I remove disease from people. We save lives on call, but I almost get as much meaning connecting with an employee who's never thought that they were valuable before as I do in like helping somebody heal from a disease. Both are giving a sense of life back to an individual who just really felt disenfranchised for a while. And I think a lot of people in medicine in general don't realize that there is a huge opportunity to find meaning in the form of leadership, because it's like you said earlier, it's just not taught in our education system.
Did you have entrepreneurial parents? Like, did you go into med school knowing that entrepreneurship was going to be a part of your journey?
No, no, I wanted to be like big time university educating professor surgeon who had a bunch of residents and did a bunch of research. Both my parents are in the university field. They're both PhDs, and that's just all I knew. And so when I went into medical school, I wanted to come out in the medical school world. And then I got really exposed to just a bunch of medical practices. And this is going to sound, oh, not the most positive, but I just never enjoyed being in the practice. I never enjoyed being around the staff or the clinicians in the actual building of the practice. Loved being in surgery, loved help, actually treating patients, operating on patients. But when it came to, interacting with patients in the clinic, that was fine. But then the negativity around the human elements of the practice outside of patient care were just not appealing. And so the primary reason I went into my own practice, I thought it has to be better than this. There has to be a way to make it more positive, or more inviting, a place people want to work. And after residency, I kind of looked at my wife and I said, at least we're going to give it a shot, see if we can build something that I don't have to dread going to work and working with the people that I'm working with.
Is your wife an MD also, or how?
No,
No.
she's actually she's kind of a jack of all trades. Stays
I'm
at home
married
with
to
our
one of
kids,
those too.
but she's a big time carpenter. So she builds a lot of furniture and stuff like that. She finds meaning not only in being a mother, but also in like building and creating
Yeah,
and doing all kinds of side projects.
that's incredible. So when you were saying before opening your own practice, and you were saying like you just had there was a negativity around it. Was that in like what percentage of ENTs, if you had to pull a number out of your butt,
Yeah,
like guess, like for go into
the
a
majority.
hospital versus like were
Yeah,
you thinking like a clinic like outside of the hospital?
private practice.
Yeah.
Yeah, so most ENTs are in private practice,
Okay.
and there's several types. So you can have a large group practice, which would be, somewhere between 10 to 15 ENTs. You can have medium small group practice, which would be somewhere between 3 and 7, and then you can have like a solo practitioner, which is just one ENT. And so when I started out, I thought to myself, in all those tiers, or the hospital owned, so all
Mhm.
those can be in the hospital system too. And so there are some wonderful practices out there that are both private and hospital run. I just never had experiences with any of them
Right.
that I was really encouraged by. And so because of that, I knew it was going to be private and I knew it was going to be my own thing, just so we could kind of set out to have the culture that we wanted.
And did you start with just you, or did you go in with other is it still
No,
just you?
yes,
Okay.
it's just me and a couple of several advanced practice providers.
Okay. So when you're presenting this to your wife, what
Mhm.
kind of fears were you guys like dealing with? Because I'm assuming any big decision like this,
Yeah.
there's like I'm feeling called to do this, but then it's also like, oh shit. Like what kind of things did you to discuss on that?
Yeah, I mean, obviously, we wanted a specific plan. Like, what is the definition of success? And if it doesn't work out, how long are we going to let this go?
Mm,
Um, so we had pretty clear guidelines in place, and anything that we do together or anything that we kind of venture out on, we do. I mean, we're not perfect. We always do our best to like kind of determine what I would say is a success metric. And then once we get going, we find out pretty quickly whether we're going to be near that or not. Now, there's a lot of emotions around that. That conversation is usually several weeks, if not
mhm.
months, to kind of land that plane. But once we get going, we both honor the fact that this is what we're going to decide is the thing that we're going to do. So it took us a while to get to that point, but honestly, after opening practice, we were really intentional to open it in a place where there was a need. We weren't just going to willy-nilly be like, all right, this is where I was born, so let's just open up a practice in the place I was born. There were some really specific things that we both wanted in a community. And so once we like agreed upon those things, we made a list of potential communities. And then we also, from a business perspective, looked at where is there going to be a need for our services. And when we were able to combine those, we found the current location that we're in.
So then what were some of the first like, what were some of the most important things that you had to decide in order to create this more positive culture compared to like
Yeah,
because, you were like, "I don't want that,"
great
but
question.
then you're like,
Yeah,
"Well, I haven't seen what I want done. I'm
gosh.
just hypothesizing it's possible."
Um, so yeah, when I first started out, I had no idea. I thought I knew.
How many
I
years have
remember
you
some,
been, in private practice like
we,
this? 3?
it's been five and a half,
Okay,
5.5 now.
okay.
So I remember when I graduated residency and I knew I was going to do this, somebody gave me a John Maxwell book, and I read it very quickly, thinking that I knew everything there was to know about leadership. And after about the first chapter, I was like, I know nothing about leadership. Opened the practice. Made some hires, which I was very excited about because they looked really good on paper. But because I didn't have any of the appropriate leadership skills, those decisions didn't go well in the beginning. So I made a bunch of mistakes I'm sure all leaders make in the form of communication, expectations, accountability. And then COVID happened. And when COVID happened, I remember sitting around the table with all of the staff we had at the time, which was there was 5 of us. And we opened because we weren't seeing patients except for emergencies. We opened a leadership book together because we had nothing else to do, and we read it, and that's the first time that we were introduced to what's our mission, like why are we here, what are we
Mhm.
doing, why are we getting up every day, what values are we going to practice under, like what makes us different than anybody else, and then what's the vision in this place, where are we going, and how are we going to know when we get there. And once we define those 3 things, as a leader I was able to take my hand off of all of the levers and let like human beings just do what human beings do best, which is do good work, and start to really see things turn around and change for the better. Especially as COVID got lifted, we were able to come out of COVID with a kind of a new mission, a new vision, and watch people really thrive in the reasons they were coming to work because it was clear why they were here.
Yeah, I was watching one of your reels that talked about the ABCs of basically
Yeah.
keeping employees around, and A was autonomy. So did you
Mhm.
have to was there a certain ego you needed to let go of? Like, because it sounds like there was a
Oh yeah.
process of trusting them.
Oh yeah, for sure. So one of the hardest lessons to learn for me, and maybe all leaders, but definitely for me, is when you hand something off to someone, they're never going to do it as well as you can.
Mhm.
And so there's typically different leaders have different recommendations, but most people would say if somebody can do something at 70% as well as you can, you should give it to them. What they don't tell you is that you have to be okay with the 70% success rate. And so you'll see somebody turn in something, you're like, gosh, that's not great. I need to take this over. But reminding yourself that no, eventually this is going to be better than I could do it. But the gap between where they are and where they're going to be, which is better than you, is a difficult part to walk through. And honestly, when you're walking through that, how you're holding them accountable. Like, are you being encouraging? Are you being complimentary? Are you being a like supporter? Or are you like detracting and pointing out the flaws and making them feel more negative than positive? So those lessons are ones that only come with time, only come with experience. And so if you don't start practicing them and making the mistakes and then having people that you trust on the team that can like have the grace for you to make those mistakes, you never get through it. Never learn it.
I will get to the B and C or let you share it, but like
Yeah,
the
sure.
problem with that process of letting go control is it's time consuming
Oh yeah.
and you're the one who makes the money.
So,
like,
yeah.
like that's the hard part of being CEO slash the CPT code person. Like I'm
Yeah.
the one
Yeah.
who brings the money in. So how did you, especially being like the sole ENT in there, like how do you find the time to
Hmm.
make sure profitability is there, yet
Right.
also like what kind of like time management are you doing? Like, how are
Yeah.
you just finding that balance of I need to be in the OR, I need to be doing consults and billing, having these billable procedures, but then also my team needs this from me, and that didn't make the business
Hmm.
any money.
Great question. So The first thing I did is and this is going to be really specific to your question, is to calculate what drives the most revenue in my time. Where am I most valuable? And what are things only I can do that no one else can do? And so as a surgeon, I'm the only one that can operate. I'm the only one in the practice that can read radiology that's done in the practice. And there's a couple of, so there's a really great book called A CEO Does Great Things, three things, and that is hiring, culture, and making vision decisions. And so if you kind of take those and apply them to a medical practice, I do those things as well. So if I'm going to boil that down, and this is probably different for every practitioner, for me, it's surgical, it's radiographical, it's making specific hiring decisions, it's setting the course for the business, and it's being specific about how we're going to get there. Those are very like high level functions business wise and very specific functions medical wise. So that means that that doesn't include seeing patients all the time. That
Mhm.
doesn't include doing all the follow-up visits. That doesn't include making all the financial decisions. That doesn't include doing all the billing and coding. That doesn't include making sure patients are checked in and checked out at a certain frequency or type, right? So anything that doesn't require me to do it, those are the things I start to offload. And that is not an easy process. Like it takes
Mhm.
time. And
And
then
money.
also, and money, right? And
Yeah.
then the more time that you're able to free up for yourself for the things that drive revenue in the business. So for me specifically, it's surgical. How do I create more time for me to do surgery? And by doing those exercises, you start to see spots in the schedule where you can be really intentional about adding high value time practice. And then finally, making sure that you're being really, really intentional about the administrative time that you're using. So, for example, today for us in our practice is our administrative day. Now, there are patients that are still being seen, new patients, follow ups, and we have providers doing that. But from an administrative perspective, we concentrate all those conversations into Wednesday morning so that
Mhm.
if anybody needs a piece of advice or anybody needs me to weigh in on something or, you know, figure out the solution to a problem, that there's set aside time for that. There's nothing more frustrating to a practice staff than a provider who's never available but still has high expectations.
Mhm. That is so good. Okay, so talk to me about the B and C of the
Sure.
ABCs of keeping your employees.
Yeah. So this is actually from a book called "Life in the Transitions," and I'm blanking on the author right now, but it's adapted from their book. Um, so B is belonging, right? So if you read any business book, and I would say like the nuts and bolts of business, and I would say like the biggest ones that come to mind, there's a ton of them, is Gino Wickman's EOS, Michael Gerber's The E-Myth Revisited. If you do Business Made Simple by the Blue Like Jazz author, Donald Miller, and there's a couple more. One's called Think Fast and Slow, and one called Four Disciplines of Execution. All of them have the framework and it's not difficult practice. It's pretty basic. It's like what we talked about. Why are we here? What are we doing? And how are we going to do it? That's where the B fits in. B is belonging. People want to feel like they're part of a team, that somebody's got their back, that when they come to work, that the people they're working with is really, they're doing it for the right reasons and they're doing it for them, not only for the patients, but they're also there to meet their needs as well. Nobody wants to come to a selfish work environment. Nobody wants to come to a place where everybody's all about themselves. So that A is autonomy, let me do my job and don't micromanage me. B is like I want to belong on as part of a team. Now you can't create a sense of belonging if you don't have a business framework to say to everyone, this is what the team is doing. So this is what the goal line is. We're a football team and we're trying to score a touchdown. What's the field and what's the touchdown?
Mhm. I would imagine because like a lot of your content, the hilarious sides, you kind of have like two different, completely different content pillars. One really
Yeah.
like soulful, meaningful, talking about healthcare burnout. Would that kind of be how you
Yeah,
would kid?
healthcare as it relates to us taking care of those who are really taking care of patients.
Yep. And then the other one is these hilarious skits on like a very ego focused physician
Hmm.
and his team. And so when you're looking through this lens of belonging and when I watch those reels, like it's like you are playing this very ego focused provider. Is that is that intentional? Like, or do you feel like ego is something that gets in the way of a lot of medical providers' like ability to lead a team?
Yeah, ego and a total lack of training on what leadership really is. And that is why like those videos ring so true to so many people because they live those moments all the time. Most of those scenes are based off interactions I've personally witnessed between physicians and their staff or been guilty of myself. And so
Hindsight's
there's a,
always 2020. You're like, oh, sorry.
yeah, right. And so there is a real, there's a real unfortunate deficit among especially surgeons, and myself included, in being able to like understand the impact of their words and actions on their team and on their patients. And so the purpose of all that content, I mean, the purpose of the comedic content is to really connect with people that we're trying to connect with, right? Not only providers, but also the healthcare workers, people that are in these situations all the time that struggle with this stuff, but they do it because they love patients. So the entire impetus for the comedic is like basically, hey, healthcare people, we see you. And
Hmm.
we want you to know that we understand what you're going through. And then try to provide some context of like, hey, like maybe there's a solution to this if we all can kind of put our heads together.
Right. Okay. So then the C of ABC.
Yeah. Yeah, absolutely. Cause is like, why are we here? What are we doing? And so if you want me to do something and we're going to do it together, what is it that we're doing and why? What is the goal line? And I didn't believe this when people first told me, but if you allow any human being, and I would say 99.999% of them, a opportunity to do good work, they will almost always do it. And so if you're just like, all right, this is where I want to go as an organization, this is where I want to go as a team, and this is, I think, how we're going to get there, people are desperate for that type of an environment of this is why I go to work, this is why I'm doing this. I didn't have to think of it on my own. I'm not just here because we're trying to help people for this vague reason, but it's specific to this reason. And this is what success looks like. People will get out of bed for that. People will stop missing work for that. People won't call out sick for that. People will go above and beyond for that. And they'll really develop a sense of like what Jeff Bezos calls work-life harmony, right? So if people are at their best selves at work, they're going to be their best selves at home. If people are working 1,000 hours a week and doing it because they think it's the right thing to do because patients need them, that's what causes burnout. And that's what
Hmm.
leads to a terrible work-life harmony or a terrible home life. And then we start to blame like work-life balance, right? Our work life's out of
Hmm.
balance. Well, it's out of balance because the type of work that we have is not creating great life.
So, both B and C, they're these beautiful, like creating vision, belonging, meaning for your employees and yourself. But like, what are some of the actual, like, boots on the ground,
Yeah,
tactical
yeah,
ways that you show up on Monday? Because, like, we do an annual meeting. Every year we do this
sure.
annual meeting and we're like reviewing our mission statement and like, we go through like this Ritz-Carlton standards of excellence thing and it's
Oh
great.
yeah,
And then, it's February and it's Monday and
yeah,
like that patient is being an asshole and this and that. So, like,
yeah.
what are some of the things that you do on a weekly or quarterly? Like, how do you
Sure.
revisit that? So it's not just one like nice diatribe to
Love
your
it.
staff.
Yeah, no, I love that. So the first thing is asking that question, right? So many people think that I'm just going to put the mission, vision, and values on a piece of paper. It's
Mhm.
in the handbook and we're done, right? So you're absolutely right. If it goes in the handbook and you put the handbook in a cupboard somewhere, then it's never going to happen. So you need to first of all live the mission, be specific about it, and it starts with the mission statement itself. Is it motivating? Is it something that makes you want to do something? Our mission statement ends with because everyone deserves a breath of fresh air. So if that's
Oh,
something
that's
I'm going to
cute.
get behind, right? So like make the people make it visceral for people. Like okay, yeah, I can get behind that. I can do that. And when it's vision, I'm not talking about like we want everyone to have a clear nose in our area. No, because that's impossible. You're never going to reach everyone. No, we want this many things to happen by this date and by following this rubric. And then once you do that, be specific about what everyone's role is to create that value, create that vision. And so everyone on the team, every week, has a very specific priority that they can easily tie to what it means to be successful as it relates to the vision. And if they hit that priority, then we'll get closer to the goal. And that priority, this is a lesson I learned the hard way a couple of times, is very employee specific. They have complete control over it. So, for example, let's say you're a vet and you're trying to increase the number of a certain type of veterinary procedure that you do, or a certain type of veterinary client or incoming whatever. You can't expect an employee to drive a patient decision.
Right.
That's
Right.
unacceptable, inappropriate, and they're going to get super frustrated. But you can expect employees to be able to drive their own decision making. And so once you set a priority, like, hey, if you do this thing, I know that this over here will increase. And you show them that. And then every week you set a reasonable, realistic goal, and they get to report on that. So in our team meetings every week, everyone has a chance to say, I hit my priority or I didn't hit my priority. And I will tell you, you do that for 3 or 4 weeks, and people on your team will start trying to find ways, if there's a risk for not hitting their priority, not because they're scared or they fear the consequences, but because they want to be an active contributor. So one of our priorities, as an example for our team members, is the MAs that are responsible for rooming the patients. They have a set of questions to ask every patient when they come in. If they ask every patient every question when they room them, then they get the check mark on their priority. And so I'll have MAs saying, hey, I missed 2 patients. Like, what can I do? Can I call those patients at home? Can I ask them the questions so that I can make sure that because they're
They
all
want to be
wanting to
able.
be contributors to the team. They want to, when they get to that team meeting, hey, guess what, guys? I did my job. I pulled my weight this week. That's
That
like going
makes.
back to that, like, belonging. We're all part of a team. I did my part.
Yeah. I mean, it's so interesting because, like, really running a business comes down to, no matter the business, it's talking about measurable KPIs that an employee has control over, feeling they understand how those KPIs lead to the bigger picture.
Yeah.
It really is, these principles are kind of universal. It's why there's so many damn good books that so many
Right.
different people have written.
Yeah.
So within the kind of like helping to heal the healer, provide for the provider, that whole
Yeah.
aspect, like when it comes to healthcare, kind of circling back to what we started with, like I'm I'm just a little concerned about the trajectory we're like going. So when especially in like even small town, I don't know how big your town is in Alabama. Um
About 100,000, like,
okay.
if you combine all the, like, outlying area.
Oh, yeah, okay. So, like, you're bigger than we are, but we're at, like, 50,000 for our county, like,
Mhm.
northern Wisconsin, and it is so our hospital has had to give up births because we can't find anesthesiologists, like, they cannot pay them enough to come in. Our vets
Right.
have been trying to do this, our dentists have, well, like, I can't get chiropractor, and so, like, when I look at the trajectory going forward, especially for I don't know if it's a small town thing as much as it's like everybody wants to move to Nashville and Colorado Springs, like we're not fun
Sure.
towns.
Yeah. Yeah.
Um, like what are some of the issues that you see us having that are fixable? Like if you
Yeah.
could
So,
wave this magic wand and kind of help change the trajectory of
yeah.
having fulfilled, happy providers across the board, what would that look like?
So top of the list is an absolute total reformation of private health insurance.
Yeah,
Um,
you rip on insurance. I love that. It's one of my favorite things about
yeah.
you.
So there has to be some type of accountability or some type of reasonability placed on the profitability of an insurance company. And I'm all about great businesses, and I'm all about, like, running a great business that's very, very profitable. But there has to be a threshold of, we're denying claims illegally, or we are intentionally using AI to make it more difficult to get patients health care. Like, there, it's almost difficult to not use morality when you're evaluating these problems. And I like to be as objective as possible. But that's number one. A lot of providers and practitioners won't even go out into practice in general because they just don't want to deal with all the problems. And so
Of
I think if
insurance.
we,
Yeah.
yeah, exactly, of insurance companies. Thank you. And so I think that if there's clear ways, and I think that AI has a lot of opportunity to help the small practitioner kind of tip the scales in their favor. to overcome them. That's our first reform. Because if I'm a practitioner, and I go out into the world and I open my doors and I know that the margins on my office visit are only like 15%,
Mhm.
I want to know that when I see a patient, I'm going to get paid. And if we can utilize AI to do that, I think that's going to open up a lot of opportunity. That has to change, I think, in order to see things change in general. And I do think we're getting closer. Number two is I'm really encouraged about the younger generation and their bend toward entrepreneurship in general. And so if we can create systems and confidence among young providers to say, hey, like you can go out into the small town and honestly do a lot of things that big tech did for remote workers. A lot of small communities allowed patients, or not patients, but employees to transplant to their community and gave them incentives to do so. I know we did. We were paying people like $30,000 to move here and be a remote worker from out of state. So I do think that the infrastructure exists in the local municipalities to incentivize these entrepreneurial minds to come. It's just they have to have the confidence in order to start the practices. And then last but not least, it's people that are in the social media space that are encouraging them to do so and reminding them like, hey, like in private practice, there's meaning. In working with patients and having employees, it's not a nightmare and a headache. It actually, if you do it the right way, it will give you a reward that you don't understand yet. And so that's honestly the largest impetus for me for social media, is to just get the word out that there's a better way, and that there's a very rewarding way. So I'm excited about what's coming. To your point, there's a big deficit of, especially in our specialty, we're supposed to have about 2,500 ENT shortage in the next like 5 to 10 years nationally. So we've got to create a system and a methodology to be able to get people in smaller communities and make it easier to get paid from a private insurance perspective, and then increase the training opportunity as well.
So, all right. So I want to ask a question, and I don't want it to I don't want to be insulting in the question. So,
No.
okay. Right, your most profitable thing is surgery, right?
Yeah,
Obviously.
absolutely.
Um, you don't get paid nearly as much to solve the problem non-surgical, right? Like,
Correct.
and so like how does that, when we look at like the trying to empower the patient too, of like creating, healthier systems, like, is there any solution that you see through insurance of like, okay, you get paid fraction or pennies on the dollar to give a consult on like lifestyle changes compared
Hmm.
to like if you were just this like, terrible money driven person, you just be like, shoot, yeah, well, he's probably going to need tubes. Like, let's
Yeah,
get that on the thing. Like, what incentive is there for
yeah,
you besides
yeah.
your heart and morality
Right.
to provide
So
more to that patient?
great question. And the answer is twofold. Number one, we have to, and you probably know this in the chiropractic space, the thing that we're after from a marketing perspective when it comes to patient care is not necessarily the disease, it's the tolerance of the disease. So, think about like, I don't know what your primary patient type is, but let's say it's back pain, just hypothetically. If you're marketing to people who are searching for back pain solutions through SEO, you're going to do okay. But what we market for are the people that are tolerating their back pain, the people that are like living with back pain. They're not even interested in getting solutions, but they haven't learned that not having back pain is the norm. And so I would argue that if we can teach people, educate patients that your productivity will go up, your lifestyle will go up, your interactions, relationships will be better if you get out of this chronic pain state. That is where we can make more revenue wise, but also educate the populace from a health improvement perspective. In our community, our primary patient type is sinus and allergy patients. And I can't tell you how often I'll see somebody they'll say, I'm here because I have difficulty with my voice. And I'm like, okay, well, let's run through all the things that be causing it. Hey, by the way, are there any sinus or allergy problems that you have? And the answer that I get is no, just the normal stuff. And I say, what's the normal stuff? And they say, well, I'm always taking about 3 or 4 different allergy pills at a time. And then I go see my urgent care provider probably about 12 times a year. And so right there, I'm looking at healthcare costs. Okay, so you're spending somewhere around $400 or $500 on over-the-counter medications, and you're also spending about $2,000 to $3,000 in urgent care visits, and you're doing that every year. So if I can get you to see, okay, you're tolerating misery instead of like dealing with the problem, I'm going to help the overall healthcare cost in general, but I'm also going to generate more revenue for my practice.
Hmm. But like, and I'm assuming in school, there is no teaching of how to avoid surgery at all, right?
Oh
Like, is
yeah.
that,
So I mean, yeah, great question. So I mean, when it comes to like patient management, I mean, the thing you want to do is obviously medically manage any condition. If I can medically manage something or lifestyle manage it, then 100% like we got to get you better. Again, if you're targeting people from a marketing standpoint who haven't been maximally treated or who
hmm
haven't been effectively treated, you're going to be dealing with the problem that you're mentioning, right? It's like,
hmm
hey, I don't want to convince you to do surgery if you don't need it,
right.
because you haven't even tried handling the problem. What I've got to teach people to do is like, hey, instead of doing all of these things that are going to never fix the problem, like probably, let's do all these things. Let's do a couple of small things that may be a surgical procedure, or maybe an allergy test, maybe some therapeutic. It may be more expensive in the short term, but it's going to help the long term. And so, yeah, I mean, even from a training perspective, if you ever see on a board exam, if medicine is an option, it's always the medical option as opposed to the surgical one almost.
hmm I guess I think where I was wondering is it even conceivable that through the insurance lens to like, if we could fix this, like if
Yeah.
we could just like fix all of this in this conversation, is it conceivable that from a business perspective, it would ever be cost effective to give the lifestyle recommendations over and over and over to your patients, or would you run yourself out of business because insurance doesn't pay you, the doctor? Like, how long before, like, if you were just so good, if you just like found this
Yeah.
like miracle lifestyle thing and magically all your patients also were like, yes,
Yeah.
I will make changes. So we won't even pretend like
Sure.
how could you stay in business? Could you hire
Yeah.
like because your insurance reimbursement, like, is there reimbursement for just life talking to a patient for however long about
Right.
lifestyle stuff? Or is that just out of the goodness of your heart?
So I think there's two answers to that question. And let me answer the question directly first. Based on specifically the type of patients that come into most doctors' offices, right? The answer to your question is no, you would see revenue go down. You'd stay in
Hmm.
business. You would see a significant drop in revenue because you're right. We live in a procedural based insurance reimbursement
Right.
society. So we're not like, it's not universal health care. We're not all paid a specific salary. So now, but I do think there's another. So if you look at just the patients you're currently seeing who wander in or come in because they're looking for a treatment solution, if I focus on lifestyle modifications for most of those that are amenable to lifestyle modifications, I might be able to save a little bit of intervention, but it's not going to be enough
Hmm.
to make a huge difference in the revenue long term.
Right.
That's the answer number one. I believe, however, that the disease burden that I deal with specifically is great enough in general in the population that if we educate the population to not only let's do the lifestyle modifications, let's educate you on how to get better without needing us, that size is so great that if we were able to target those, get them in the door, treat them appropriately, which is what we do, you're not going to see, if anything, you're going to see an increase in revenue, even if you're maximizing lifestyle intervention.
Because their friends will be so happy and they'll say, yes, yeah, you'll just be being a good doctor, and that karma will like
Yeah.
work
Word of
like
mouth marketing.
marketing slash
Yeah.
karma. Okay. All right. Final question.
Yeah.
How did you decide that you had time to start doing social media stuff? And like, what's your goal with it? I mean, I know your initial goal. Like, I know, you
Yeah.
wanted to have, but like, what do you want to create a course for provider? Like, do you have, because it's obviously taking time, like away from any time you're making a reel or putting content out. Like, it's time consuming. It definitely is. Is it fueling creativity? and purely a passion
Yeah.
project? Like
Yeah.
what's the plan?
Well, number one, it creates jobs. My main social media guy, he's sitting right next to me. His name is Blaze,
Hi,
and he
Blaze.
like it. So that's number one. But I think, to answer that question, we've had several iterations. So from a course perspective, we actually do have a free course that people can check out at a website called providerautonomy.com. It's an entire oh gosh, I think it's like, what is that, 10 parts? It's like a 10-part course, absolutely free. There's a practice diagnostic in there to kind of analyze like how well you're doing. But it's really a gift from us to any provider who wants to be like, all right, do I have can I start a practice? It's just going to answer that question for you. And like, what are some nuts and the bolts of like having the questions and answering the questions that you talked about today, mission, vision, values. That's number one. Number two is to just really grow the voice of what we're trying to set, like what we're trying to promote, like that there is a such thing as individualized practice. There is a way to connect, not only medicine with meaning, but also like management with meaning. And I'm talking about specifically healthcare management, employee engagement, because if we can improve those things, the thing that kind of got me into private practice is just seeing all the things done wrong. If we can set ourselves up as, oh, I don't know, a resource or an authority on how to run a good practice from a healthy perspective, that would be the goal. That
Mhm.
if two or three or 2 or 300 or 2 or 3,000 or 200,000 practices, like we're like, well, hold on, like maybe we could try that model. Maybe we could try to do it that way. And we could help more patients, we could help more employees, and we could create better practices and get in those small communities that you're talking about getting into.
Yeah. Well, Caleb, I think you're incredible, and I love your social media from both perspective, the heartful side and the funny side. And I just can really get behind what you're trying to do. So
Thank you.
thank you for coming on the podcast today and playing along.
Yeah.
I think it's funny. I'll share that like me sliding into your DMs, like if you don't hate chiropractors and would be willing to come
Yeah.
on, I would love to have
Absolutely.
a great conversation.
Yeah.
So
No, thank you for inviting me. Anybody that promotes some type of provider autonomy or private practice, I'm 100% in favor of. So thank you for what you do too.
thank you. All right, She Slayers. Until next week. Bye.